into exercise interventions for this patient after our manual therapy techniques. So some of these I'm gonna have them do at home, and at least one of them we're gonna do just in the clinic or maybe at home, we'll see. Let me have you sit on up there. So we just worked on your left rotation and right side bending at your upper cervical. And so I want to facilitate maintenance of that range as well, something that's not going to irritate his current symptoms at the lower levels. So we're going to do what's called muscle energy technique, where I'm gonna have you're gonna turn into your hand, you're gonna use your own hand on your left temple region, where you're going to turn and hold. So your hand and your head are producing even amounts of pressure. And we're gonna slowly increase the range to learn stabilization or teach your neck stabilization in the different ranges that we need to get into. So I'm gonna have you just start straight ahead. We're just gonna push and hold for 5 seconds. Again, this is like a 50-50, this is not a big effort, it's just to contract the neck. So you'll hold for 5 seconds, and then we're going to go a little bit more to the left, 5-second hold, and then we'll go a little bit to the left again, 5-second hold. And we'll do those 3, okay? Let's see it. Good. Good, that looked excellent. All right, now we're gonna do the right side bending that goes with this range. So again, facing forward first, I'm gonna have you, it's not a big side bend, it's not the whole neck going, it's just a little, like your nose is the center of rotation there. So you're just gonna do a little push, but the caveat is now after the first one, we're gonna turn a little left and then side bend, resist. And then turn a little more, side bend, resist. Okay, so let's try that. Good. Good. Does that feel okay on your symptoms? Okay, good. All right, next one, we're gonna do similar direction, but now you're gonna kind of resist through the motion. So you're gonna try to keep the head level. We're not gonna try to side bend either direction. You're gonna try to keep it level while you resist turning and then resist turning back. So now we're using both hands. And so I'll have you count 1, 2, 3, 4. 1, 2, 3, 4. And you're only going about halfway, okay?
Okay.
So if full range was over your shoulder, you're only going in between. All right, so try 3 of those, okay? Good. Excellent. 1 and good. Keeping the head very level, looks nice. Good. You started a side bend on that last one. That's okay. So what I'll have you do is do it in a mirror so that you can kind of see what your head is doing. All right. Last one. I'm going to have you stand on up. So because this happened during golf, I want to start training the stability with golf. So I suspect if you're righty, it might have been the backswing. So we're going to work on that because that requires your head to be able to relatively turn left, even though your chest is the one moving. So I'm going to have you pull. We're only going to go like halfway just to start the range and start the stabilization training. So I'm going to have you do a little bit of a tuck. I don't want your head hanging forward. I want a little bit, a back position. And then you're just going to bring, while you're looking down at the ground, pretend there's a ball there, and bring the band. Okay? Let's do 10 of those, okay? Let's just start with 5 and see how that feels on your symptoms. Good. A little too much, a little less. Right to my hands. Good. Good. Excellent. All right, that felt okay?
Yep.
Perfect. So I'm gonna have you try probably all 3 of those. Maybe we'll start with the first 3 and then we'll review this one next time and then we'll maybe add it to home. All right, and that concludes the exercise portion of what we would do with this upper quarter quads.